arm swings. So there is swinging of the arms opposite to the stride. Okay, and they, again, the movement of the arms is different. Okay, so that's for the inspection of the stance and gait. And then we move on to inspect and palpate the spine. So like we said, observe now for the curves. So this is the cervical. It's more concave. The thoracic is convex. Go to the lumbar, it's again concave. And then the sacral, it's more convex. Okay. Now, check also, okay, when, of course, the patient should not have the clothes on, but you will be able to see the spinous processes, and it will be aligned. So that's when you will know that there is perfect alignment of the spine. Okay. And then we move to do the range of motion of the spine. So, for the range of motion, there will be the different angles that you need to know. For purposes of the lab skills, we need to know them. Because you cannot tell me normal. So you have to give me the normal range of motion, okay? But for purposes of the comprehensive exam, you do not need to memorize them. Very good. Okay, so again, it's important that you ask your patient, give your patients the instructions. You cannot just say flex to the right or extend this and that. You need to give very specific instructions. So the first range of motion for the spine will be flexion. So we ask the patient, try to touch your toes.
Just so you know, I do have stenosis of my spine and a herniated disc, so I'm not very good at it.
No problem. Okay. You don't have to force
That's
it.
pretty good for
Yeah.
Some people can't even do that.
L4, L5 herniation.
Oh, really? Okay. So you'll notice there are some people who will be able to touch the toes, some who will just be able to do it this way. So the normal angle that we're looking at is from 75 to 90. So it's not just one single number, 75 to 90. So ask the patient to bend forward to touch the toes. Okay, and then when the patient, okay, back to normal position, that is extension, 90 degrees. Okay, now when we ask our patient, can you bend backwards? This is hyperextension.
That's kind of scary.
Okay, so the bending backwards, it's not the head that we're looking at, it's the spine. And hyperextension is 30 degrees. So you don't expect the patient to be able to bring the head all the way to the
What was it, 30
back.
degrees?
30.
30. Okay, so that is hyperextension. And then we ask the patient, can you bend to your right and bend to the left? So this is lateral bending or lateral flexion, and that is 35 degrees. Okay. And then we ask our patient.
Do you need me to get the pen light and look at it?
Okay, we ask the patient to twist sideways, but you need to stabilize the hip. Okay, so ask the patient, twist sideways, to the right, and to the left, and this is 30 degrees. Okay, so let's recap. So for the motion of the range of motion of the spine, okay, flexion, then touch your toes, 75 to 90. Okay, back to normal position. Extension is, hold on.
Oh, sorry.
Extension is 90. Okay, can you please bend backwards? Hyperextension, this is 30 degrees. Okay, and the lateral bending, you can bend sideways to your right and then to your left. Okay, this is 35. And then we ask the patient, twist your body to the right and to the left. Okay, so this is 30 degrees. Okay, and then